Hello, my name is Dr. Aziza Shepard. Myself and Shadana Weathers are the executive leadership for Ohana Center. Ohana Center is a small grassroots nonprofit with a mission to provide families with the tools they need to stay on the road to stability. We seek to support underserved, at-risk families in the Antelope Valley. Ohana Center's vision is to bridge the gap between community, family, and home life. From my own experience as a mental health clinician in the Antelope Valley, I have seen and experienced firsthand how important a better understanding of mental health can be for the Black community. Today, and as well in the past, in the United States and around the world, a storm cloud of hegemony, oppression, microaggressions, and trauma have caused an explicit divide between Black and white and rich and poor. This divide affects the allocation and distribution of economic and healthcare resources. Today, the cloud of racism casts a looming shadow of despair. The destructive forces created by the storm cloud don't hit everyone, but seem to target individuals who are Black and brown and the most vulnerable. The effects of the lightning strikes produced by the clouds of oppression are trauma, mistrust, and dis-ease. Research has shown the roots of mental health stigma and avoidance in the Black community can be linked to the enslavement of Africans in the United States and is carried on today by health systems and ideologies based on racist beliefs and practices. Mental health is important to the Black community because it is something that encompasses not only the individual, but is an intersection of community, government, laws, and access to resources. Data indicates that Black African American individuals access mental health resources far less than their community counterparts. Ohana Center leadership promotes personal and community well-being through grassroots outreach and engagement. With our mission to provide individuals and families with the tools they need to stay on the road to stability, our goal is to provide accessible resources to the most vulnerable populations of all ages who are at risk of developing serious mental health conditions, to acquire psychoeducational tools and skills through activities that reduce ongoing stress, prevent serious mental health conditions, and decrease isolation in people most at risk. Now that's Black history, that's outreach, and we hope to see you in the community. Thank you from Ohana Center.